welcome to another episode on Public Health Answers. Since the outbreak of the pandemic, the World Health Organization has taken on a leading role in global public health. Their international influence has allowed citizens, public health professionals, and governance systems to coordinate evidence-based responses to managing the virus. I am therefore very excited to introduce you to Dr. Rüdiger Krech. He is the director of the Department of Health Promotion at the World Health Organization. He oversees WHO's work on tobacco, physical activity, health promotion, as well as health literacy and community engagement, and many more key areas. Thank you very much for joining us today, Dr. Krech. I will start with my first question. So, has the role of WHO changed since the outbreak of SARS-CoV-2?
Thank you very much, Rosa. And I'm delighted to be on this webinar. Has the role changed for WHO? Well, first of all, we will see the outcomes of the External Review Committee of COVID-19, which we await to be available in May next year. So it's not yet finalized. But what we can see, let's have a look at the overall situation. We have been warning about severe risks for an epidemic or pandemic for years now. We have had wake-up calls in the world 15 years ago with H5N1, 10 years ago with H1N1, 5 years ago with Ebola, and now we have COVID-19. And if you look at the severity, it increased every time. So actually, there is a need for global health to be much more taken seriously when it comes to decision-making in other sectors, because all these epidemics have been caused by decisions in other sectors. It's not just whether wild animals are sold on wet markets without being analyzed before, so that so unnoticed actually. So, but that's not the only thing. The way we have actually shaped globalization means that whatever happens in whatever country has impacts on all the others, because at the same time, mobility has increased so much. Every year, the International Aviation Organization, IATA, has actually measured an increase of 1.5% of mobility every year. That means that this world has become a place where nothing stays within nations. So bugs don't respect borders, and therefore you need a place, an organization that looks at these potential risks that might actually cause another pandemic. And I don't see any other organization than WHO to be that organization.
Can you name successful strategies and approaches of countries with a lack of resources which have successfully managed to mitigate the virus so far?
Well, yes, you can see it in the infection rates. It's a reflection of how you're dealing with the virus. We see in some countries that it was able to be contained very quickly through very severe measures. And some countries who took this seriously, who based their public health measures on evidence, are much better off than those countries who have not done that. You can see also that those countries where actually people actually accept this, right? Where they say, all right, there's measures which come now from the government, the local, the national, the regional government, and we comply, have been much better off than those countries where you had groups of people who would not comply to those measures. And that has to do also not only with the political culture of that country, but at the same time, it has to do with whether or not the governments were able to communicate and to co-design those measures so that people could make sense out of the measures that have been taken. So that you then see how this works within your own environment in which you live, work, and grow. That has been a decisive success factor as well. And so therefore, many of the health promotion instruments that we have, where you engage with the community, where we know that if you get a health advice by your physician, how do you comply with that health advice? So there's a lot of experience in health promotion that can now be translated into the measures of this pandemic. And so actually you just look at the current rates of infection and you see which countries have been successful and which ones have not.
Now, what can we do to prevent the next pandemic?
Yeah. So as I said before, there's many risks that we already know. We have identified about 40 different risks. It's not just the pathogens that we've done an exercise which is called Disease X, where we said we don't know the next pathogen, but what would we need to do if this comes into the world? But if you look at the way we need to look at building back better, that it's definitely not just going to the routine from before. Because if we do that, the likelihood of a next pandemic is extremely high. So we are discussing with other partners, many UN agencies, civil society organizations, to apply what we call a One Health approach, where we look at environmental and human health factors. So animal health and human health, where we look at how we treat this planet, where actually we look at the huge inequities that we see around the world that are increasing and by themselves create a big risk for diseases to emerge and spread. Mm-hmm. So we actually want to have a serious discussion about a radical change in the way we look at development, where we now see that just looking at economic growth is not the best way of looking how we actually thrive and how we develop as a global community. So we believe that there must be other criteria that will actually lead to a healthier development for all. And one of the concepts that we're pursuing in this regard is well-being. Because, as I said, many decisions by other sectors have huge impacts on global health. And so to work with those other sectors to understand their agendas, their professional language, their ways of pursuing their goals, and how this actually relates to health. That is something that actually will actually prevent or have a much higher likelihood of preventing a next epidemic or pandemic. And so by looking at well-being, we believe that we are creating a framework under which many other sectors can come together. So, yeah, that is an attempt, at least, to seriously address the huge risks that we face in this world for a next pandemic.
So thank you very much for these interesting key insights, especially on the One Health approach with the focus on well-being. We're honored that you're part of our program.
Thank you very much, Rochelle, for this opportunity.